Welcome to the HBR Video Quick Take. I'm Todd Pruzan, Senior Editor for Research and Special Projects at Harvard Business Review. Today, I'm here with Madhu Palkar, Chief Strategy Officer and Chief of Staff to UHG Global. Madhu also serves on UHC's Culture, Diversity, Equity, and Inclusion Council. Today, Madhu will be talking about how we can use technology to simplify and transform healthcare. Madhu, thank you so much for joining us today.
Thank you so much, Todd, for having me. I really appreciate the opportunity to speak with you and your listeners.
We're glad you're here. What do you mean by simplification of healthcare through technology? Who does that benefit?
Sure. So when we think about healthcare, there are so many participants in healthcare, from clinicians, care providers, payers, or insurance companies. We also have government agencies, pharma life sciences companies, employers, payers, you get it. It's literally everybody, right? But everyone's goal ultimately is to serve the consumer, that human on the other end. Now, for all the stakeholders that I just listed, for them to be successful, they must be able to convince the consumer of the value that they drive and to drive then further consumer adoption of the services that they bring to the table. Now, that consumer adoption comes when we reduce the complexity, that confusion that people talk about when they talk about healthcare. It needs to create an integrated experience, a simple experience that is easy to navigate. It's transparent and enables improved outcomes. Well, let's think about it, right? Oh, if I feel like I'm not feeling well, I don't know if I should go to my doctor. Well, let me schedule a virtual visit with my doctor or on an online portal. But how much is it going to cost? That's when you need to then check on your insurance, right? There are now, within United Healthcare, we have a solution, for example, called as Bind Healthcare that helps me understand upfront how much it costs. That is simplification. That is transparency. Now, technology's key role, right, is to enable the simplification of that experience. And that simplification of experience that we talk about is about providing relevant information so that I, as a consumer, can have a perfect action.
Madhu, how is digital helping with the simplification of experience for consumers?
Sure. So consumers touch healthcare through various channels, right? So we know that you can reach, through a pharmacist. A consumer can reach in through a physician, via fax, via phone, via insurance company service rep, right? Health coach, telemedicine. So it's kind of like through any of these channels. It is so daunting, as you may imagine, to navigate across these channels to help plan for you and your loved ones. I mean, we have all been there. What consumers want is a direct engagement, a direct relationship. They want exact relevant information at the right time and place. The consumer needs is transparency, like we just talked about, so that they can make that right health as well as financial decisions. So because they want to make sure they're protected both from a health standpoint as well as from a financial standpoint. We at United Health Group have a consumer walk in through either one of the Optum engagements like Optum Rx, or through our clinic, or through the Optum store. Or then our consumer is a member of our United Healthcare insurance plan. They come in through My UHC. Now, digital technology, right? When we talk about digital technology helps that consumer, that individual, navigate successfully across all of these channels, across technology as well as human interactions. A ton of complex things can happen in the back, Todd, but for you and me as a consumer, we don't see, hear, or experience that. Lastly, like I said, it is about reducing that financial stress, the financial burden, the mental stress, and also improve that trust in the overall system. Let me give you a quick example. So for our Colombia market, we have this very simple digital omni-channel experience through Dr. Cole Medica, where a patient can schedule a virtual visit, but they meet with their physician or their specialist in person. When they do have that in-person, or they toggle between the in-person versus, and then the virtual, they have all the information at their fingertips to provide a unified experience. And the patient will not have any service differentiation. This is all happening with digital. So this is when we talk about digital helping with simplification of experience. This is all through that technology and our digital assets working seamlessly together.
So Madhu, how is technology helping with managing health costs?
Todd, it is no longer, the days when we talked about these cool point solutions. Of course, we need innovation in specific singular areas, but all of that innovation, all of those point solutions, they all need to be integrated within the health system. When that happens, right? When that happens, that's when we are essentially managing and reducing the cost, because we're reducing that unnecessary either spend, unnecessary steps in the system that don't add value ultimately to the consumer, both for the health outcome as well as from a financial standpoint for all of these stakeholders that are playing in the backdrop. So for us, we leverage technology to create that integrated across the value chain of every stakeholder. So for example, if you look at the payer has their own value chain. A provider has their different value chain, the life sciences, and so on and so forth. So when we bring market leading expertise across the continuum, we talk about our greatest differentiator is that ability to reduce that overall cost by streamlining the entire system, reducing the fraud in the system, reducing the waste in the system, reducing sort of like that unnecessary avoidable steps. And then, we also ultimately leverage this BI analytics to improve the overall process. So when we hand this technology, these digital assets to the people using them, right? They have this efficient and effective administrative and clinical guidelines to help them reduce the overall cost to the system.
So how do you use data analytics and technology to improve access?
Sure. So United Health Group, we serve diverse groups across the world. And each of these diverse groups, they have their own unique needs. They have, they come from different cultures, from different socioeconomic backgrounds, their geographies. And then as we are working across different countries, each country has their rules, their regulations. We leverage data analytics and technology to tailor our product offerings by each country. And then within that country, we will also make it relevant for consumers of specific regional areas so they can gain fast, easy access. If you're living in Sao Paulo in Brazil, right, you need access to your relevant physician in that region. You want to make sure that they are high quality, that they are specialized in that area. So, for example, our America's medical services in Brazil, right? They have used their data technology to both sort of like understand, hey, what are the most critical health conditions and which physicians can help those patients most effectively and what technology can be leveraged for that disease area. And so, we've created these centers of excellence that can help as a consumer or as a patient walks in through a door with a certain health condition, he or she can be helped across all aspects of that disease. And so these are sort of like some of the ways that we have used, data and analytics to improve access.
So Madhu, how is technology simplifying care?
Sure. I just talked about sort of like, technology, analytics, and how it is helping patients with certain disease areas. That's one way. But then there's this other aspect of helping patients figure out the right modality of care. By that, I mean, is that, in COVID sort of showed it a bit for us, right? Which was telemedicine. it helped us sort of like adapt a bit as well. But we need to know as a consumer, like, do I really need to go to a specialist when I have a headache? Or do I need to go to my PCP? Or do I just call into sort of like my virtual health clinic? So all of these modalities, what is the right care? What is how do I get to that right physician or that care provider? I think that is about sort of like simplifying the care aspect. But then we also use it to avoid, we provide that same information, that analytics to the clinicians as well, to the care providers as well, so that they can ensure that they have all the right patient information to avoid unnecessary ER visits, avoid unnecessary readmissions. And that, as they're sharing these, the patient information across the various clinical settings, they can avoid complications, and provide sort of like secondary care management. And when I say care, I actually mean the whole human, both the medical side as well as the mental health side. And so as we talk about care, we have also continued to link mental and physical health, sort of like the whole person together. And so that is, again, something that technology has enabled us to do.
So what can other industries learn from healthcare technology?
Sure. So I thought of, a bit about that. And of course, healthcare has a lot to learn from other industries as well. But when I think, what is it that I'm most proud of as a member of the healthcare community, I would say that it's our ability to change, our ability to adapt, and continue to focus on the people that we serve. With COVID came a lot of challenges for us, for our partners, for everybody in this healthcare arena, as we know. But people really rallied together. People really came together, and people said, okay, hey, what is in the best interest of the person, of the people that we serve, of the communities that we serve? And so, we know that it's a serious responsibility. And so we ensure that the data that we have, and the health of the people in the communities that we serve is always the true north. So when technology is leveraged for healthcare, the goal of that technology is always to add value to the lives of the people that we serve. And that's always been our true north. And I think, if anything, that is something very unique to healthcare.
Thank you. Well, Madhu, this has been a great discussion. Thank you so much for joining us today.
Thank you so much, Todd. It was my pleasure. I really appreciate the opportunity to be here with you and your viewers.
Thank you. To learn more about United Healthcare, please visit uhg.com or click the link below.